Hi, I'm Lee Reichman. I'm Senior Advisor at the Global TB Institute. And the question was asked about the role and worth of case management. And I can safely say over 45 years, having watched TB develop through self-administered therapy and directly observed therapy, and then finally directly observed therapy with case management, the critical ingredient is the nurse case management. Just having directly observed therapy by road every day or 5 or 7 days a week is important, but it's that extra information, empathy, concern that's provided by the nurse which makes the difference. And I think that now as people move on to video DOT, video DOT is the solution to everything in life, it sounds like. But I think all the people doing video DOT are forgetting that the nurse case management component is totally missing. And I predict that that's going to be a big problem with video DOT. Thanks for letting me comment.
Hi, I'm Henry Freimau. I'm the physician medical consultant to the Southern New Jersey Regional TB Clinic. And I wanted to talk about how important the case management and the case managers are to the care of the patients that we take care of. Although we obsess and focus on their TB issues, all of our patients, or the vast majority of them, have many, many other complicated needs, both medical and social. Many of them have poor resources, many of them are undocumented, and trying to get them to get their TB therapy and achieve our goals also involves trying to deal with a lot of their other complicated issues. And without the case managers from the counties that we work with, who really struggle with trying to get these patients the other things they need, we would never be able to successfully treat their tuberculosis.
I'm John Bernardo from Boston University in the Massachusetts Department of Public Health, and I've been doing tuberculosis work for a long time. To my mind, nursing case management has been central to our success over the past 2 decades in managing tuberculosis in the United States. The relationship that the nurse develops with the patient brings together the clinical skills that nurses receive in training with the personal and interactive skills that the nurse develops throughout his or her career to engage patients and get them through treatment courses that are potentially toxic and can result in serious consequences if not managed properly.
I'm Jane Carter. I'm a pulmonary physician from Rhode Island and have done TB work for about 25 years there, and I'm the current president of the International Union Against TB and Lung Disease. What's the importance of nurse case management? Personally, I think it's the cornerstone of all TB care nationally or globally. It always seems to be the nurses who have the best interactions and know the patients the best. The physicians think at a sort of different level, and I think that we just miss many of those cues that make the personal connection with the patients. And it's really that personal connection that allows the nurses to get the information to really do the case management that we know really is what cures TB. I was just talking with Lee Reichman today, and he remembers publishing a paper years ago that demonstrated self-administered medicine was the least effective, DOT was the next effective, but the most effective thing in completing patients to cure was directly observed therapy with nurse case management.
Hi, my name is Dr. Lynn Sosa, and I am the tuberculosis controller in the state of Connecticut, and I run the program. And for me, nursing case management is really key to having good outcomes for our patients. So when we look at our data, in a lot of different ways and look at outcomes, things like getting an HIV test or completing treatment or getting directly observed therapy. It's the patients that had nursing case management that actually have those things done. And when they don't have that nursing case management, then they don't have those things done and they don't have as good outcomes. So for us, when we don't have that person talking to the patient every day, making sure that they're taking their medicines, making sure that they aren't having any trouble, making sure they get to their appointments, it just doesn't go as well. And it's really hard for patients. They're on medicines for a really long time. They're on medicines that can have toxicities. They have a lot of questions. And it's really important that they have somebody to talk to that they know is knowledgeable and can help them.